Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a December 14th, 2020 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 case total has creeped to almost 9,700 cases, with 303 cases reported in the last 7 days. Even though our 14-day average positivity rate has declined to 13%, we still must continue to wear masks, social distance, and practice all the public health measures we've learned over the past 8 months. Local hospitalizations have stabilized, and statewide hospitalizations have decreased. During a time, however, when we continue to see record numbers of cases and deaths on a national level, we must continue to hang on and keep doing the public health measures we've been doing to bring these case numbers down, especially avoiding small gatherings with others outside your immediate households. Friday, the U.S. had yet another record number of cases reported for one day, just over 236,000, and is also quickly approaching 300,000 deaths. In fact, in a paper by Patrick Heveline, who's at the California Center for Population Research at the University of California in Los Angeles, the U.S. life expectancy at birth will decline by more than 1 year in 2020. This hasn't happened since World War II. COVID-19 is having a huge impact on our U.S. mortality and has canceled out many improvements made in life expectancy in recent years. Iowa is receiving our first allotment of the 26,000 doses of Pfizer vaccine anytime now, and we know these first doses will be administered to some of the over 4,800 healthcare workers here in Dubuque County, along with long-term care residents and staff beginning the week of December 28th. Our incident management team is receiving a lot of questions from citizens and work sites on when and where they can get the vaccine. Please be patient as we learn more and await notification on future allocations. We will be providing ongoing public information on how and where to get vaccinated. At the same time, we understand that some people may be concerned about getting vaccinated with the new COVID-19 vaccine. While these Pfizer and Moderna vaccines were developed more quickly than some of our previous vaccines, routine processes and procedures remain in place to ensure the safety of any vaccine that is authorized or approved for use is safe. Safety is a top priority, and there are many reasons to get vaccinated. This type of vaccine, using messenger RNA, has been in development for over a decade. Messenger RNA vaccines are a new type of vaccine to protect against infectious diseases. To trigger an immune response, many vaccines put a weakened or inactivated germ into our bodies. Not messenger RNA vaccines. Instead, they teach our cells how to make a protein, or even just a piece of a protein, that triggers an immune response inside our bodies. That immune response, which produces antibodies, is what protects us from getting infected if the real virus enters our bodies. So in other words, messenger RNA are instructions for how our cells can make a protein to start our body's ability to fight off COVID-19. Messenger RNA is not able to alter or modify a person's genetic makeup or our DNA, and it won't enter the nucleus of the cell, which is where our DNA are kept. This means that messenger RNA does not affect or interact with our DNA in any way. These messenger RNA COVID-19 vaccines work with the body's natural defenses to safely develop protection or immunity to disease. I'll explain more about this kind of vaccine immunity in the next few weeks, but this is probably enough for our brains to handle today. Another component of this exciting vaccine approval news is providing information to our hospitals and clinics on how to handle, prepare, and administer this Pfizer vaccine. Detailed information is now available along with any potential side effects a person who receives the vaccine may experience. For both doses that need to be given for the vaccine to become effective, the most common side effects noted in the trials are muscle soreness on the arm where you get the vaccine, along with injection site pain, swelling, or redness. You may also experience tiredness or a headache, muscle pain, chills, joint pain, and/or a fever. These side effects are also very common with other vaccines we receive, either childhood vaccinations or adult ones, such as those for influenza or shingles. And with all vaccines, the limited time we may have some mild side effects far outweighs the risk of getting the actual disease. As we start a new week, you will continue to hear more about vaccines and where they're going. Don't lose sight of the fact that we are still battling this virus and will for some time. Remember, the virus will keep seeking out uninfected people, and there are plenty of us out there who will be vulnerable until we reach herd immunity through the vaccine administration sometime by mid-2021. So hang in there. We appreciate all you're doing to keep yourself and others safe and healthy. Have a great week, everyone, and this week, let's all make an effort to reach out to someone who is lonely, isolated, or just down in the dumps. We need to keep each other's brain health strong too, because we're all in this together.